Hello everyone, my name is Nachum, and today I'll be presenting my research project, an accessible Parkinson's and Alzheimer's novel diagnostic framework using vision-based handwriting kinematic analysis and machine learning, which I termed PANDwriting for short. I was inspired to pursue this project after losing my Holocaust survivor grandfather to a difficult battle with Alzheimer's disease. I knew I wanted to use my skills in computer science to impact this field, and I quickly found that the neurodegenerative disease diagnostic process is expensive, long, complex, and ultimately inaccurate, which is a leading cause of poor treatment outcomes. The current diagnostic process involves multiple doctors leveraging a variety of approaches and their clinical judgment to rule out other causes for symptoms. This process can take several years and is only 75% accurate. Handwriting kinematics have been shown to be biomarkers of neurodegenerative diseases. However, techniques to capture and analyze handwriting data rely on specialized digitizing tablets, which are expensive, inaccessible, and difficult for patients to use. As such, my goal is to develop an accessible, fast, and first ever smartphone system for neurodegenerative disease diagnosis using computer vision and machine learning for fine kinematic analysis of handwriting movements. And this framework has the potential for major impact as a widespread and inexpensive tool for neurodegenerative disease screening. To develop the system, I first created a computer vision architecture to quantify fine motor movements from videos. I then used the system depicted in Figure 1 to collect synchronized data from a digitizing tablet and smartphone camera to compare and test the accuracy of my vision-based system. I then used a dataset of digitizing tablet data for Parkinson's disease patients and healthy controls, which I downsampled to 60 Hz to simulate vision-based data. And lastly, I trained an enhanced machine learning algorithm on this dataset to test the accuracy of diagnostic assessments. This flowchart encapsulates my computer vision architecture for this project. I'd like to draw your attention to the recurrent region of interest feature matching algorithm, which I developed myself. This algorithm utilizes the pen's previous position and velocity information to predict where it will be in the future, narrowing down the search area and making the algorithm less computationally expensive and more accurate. Furthermore, I use perspective transform matrices to produce a top-down view of the paper, making my system versatile through its ability to analyze and produce accurate data from videos captured at any angles at which all four corners of the paper and pen tip are visible. The second major part of this project was developing an enhanced machine learning framework to provide diagnostic assessments. I used the Parkinson's handwriting dataset, which provided pen tip coordinates and associated timestamps, which I downsampled and filtered, and then used to calculate kinematic features such as speed, acceleration, and jerk. These were then used to compute a total of 176 derived features, which I tested for statistical significance to narrow down the feature set to the 27 most significant features. These were then fed into a 10-fold cross-validation structure, which trained an ensemble classifier, where each classifier in the ensemble casts a vote on the patient's condition, and the outcome with the most votes was chosen. Now, this structure was demonstrated using a dataset of Parkinson's disease patients. However, it is applicable also for Alzheimer's disease and mild cognitive impairments, and I'm currently working with doctors at the Innova Hospital System to collect further data to test this framework. The figure here displays kinematic data from a representative Archimedean spiral task and demonstrates the nearly identical information captured by my vision-based system in blue as compared to the digitizing tablet in orange, including position, speed, acceleration, and jerk. This high accuracy is further demonstrated by the quantitative data in the table, summarizing errors for kinematic features over the 146 recorded handwriting tasks. The position error is less than half a millimeter, and speed and acceleration errors are less than 1.1%. I achieved an accuracy of 74% in distinguishing Parkinson's disease patients from healthy controls, which closely rivals clinical diagnostic accuracy. Through this, I demonstrated that high accuracy discriminative analysis is possible with vision-based data, in spite of the reduced sampling rate and need for filtered data to account for noise and vision-induced jitter. Using the data I collected, I was also able to train a proof-of-concept convolutional neural network on over 40,000 collected frames to estimate pen tip pressure. I achieved an error of less than 9%, and this proof of concept demonstrates the potential for improved learning-based models to estimate pen tip pressure with computer vision. And this is important because it has literature-supported potential to increase diagnostic accuracy by as much as 10%. So why is this all important? PANwriting is an accessible, fast, and cost-effective system for neurodegenerative disease screening that enables wider access to diagnostic assessments for lower-income populations and resource-poor health systems, while offering an accessible tool for long-term monitoring via telemedicine. Vision-based systems also offer more information, such as pen grip and arm pose, which can be used to improve diagnostic accuracy. Overall, the PANwriting framework, which is the first ever vision-based system for kinematic analysis of fine motor movement, can be leveraged for screening for any health conditions in which biomarkers are displayed in handwriting movements, including not just neurodegenerative diseases, but also strokes, early developmental disorders, and arthritis. My future directions for this research include collecting data so I can further test and increase my accuracy while demonstrating the value of vision-specific features. I would also like to provide rationale behind diagnoses, such as annotated videos which highlight abnormal movements, and also to test a regression-based machine learning system to monitor disease progression. In conclusion, I've demonstrated that computer vision systems can capture accurate kinematic data of fine motor movement tasks, which can in turn be used for high accuracy neurodegenerative disease diagnostic assessments with machine learning. With both of these together, I successfully developed PANDwriting, an end-to-end, accessible, and fast diagnostic system for neurodegenerative diseases with a massive potential to increase access and improve treatment outcomes. With a PANwriting system, fine motor movement can be inexpensively used to screen for hard-to-diagnose diseases on a wide scale and in just a few minutes, with accuracy rivaling that of the clinical process. Thank you for listening.